like this? Obviously, nobody. Because everybody wants their teeth to be nice and clean. And everybody wants to have a pretty smile because everybody talks with their teeth, obviously. So, I am an active dental assistant, and I work at Carter Dental. And I was on the dean's list at my dental assisting school. And this is caused by not flossing your teeth. How many of you floss your teeth regularly? How many do it more than once a day? Okay. I know half of you guys are lying. Because most people do not floss their teeth. They think it's not important. So I'm going to go through with you today why flossing is important, proper brushing technique is important, and the negative effects that if you don't floss and brush your teeth, that stuff like this is going to happen. So first, since everybody likes their teeth and everybody likes to smile, your overall health of your body is very important, and it starts with your mouth. So you have to have good oral hygiene to have a good rest of your health. So first, proper brushing techniques. So this right here is caused by improper brushing techniques, as well as that. Let me turn the lights off, it's a little bit better to see. But if you don't, there are 3 better methods to brushing your teeth so this stuff doesn't happen. The first method is called the Bass method, which is where you place the toothbrush at a 45-degree angle into the gums or the sulcus, and you roll down. The sulcus is where the popcorn kernels get stuck and all of that kind of stuff. And you roll it down so that you get all of the bacteria from inside your gums, and you roll it down so it's out of your teeth. That's the most effective, but it also depends on which dexterity you have in your wrists. Does everybody know what dexterity is? Well, if nobody knows what dexterity is, it's how the motion of your wrist. So if you have full dexterity, you can move your wrist all the way around, doesn't hurt anything. If you have intermediate, you might have like broken your wrist or had surgery on it, so it's a little tight. If you have no dexterity, it's like children and older people, they don't have very much movement in their wrists. The Bass method is going to be the easiest method to learn, but you have to have the most dexterity in your wrists. And according to modern dental assisting, you place the bristles up into the sulcus, and then you swoop it down, just like I had said before. And it's very, very easy to learn. And then it does get all of the plaque and the bacteria out of these areas. And you can do it on the lingual surfaces as well as the facial buccal surfaces. The next one, the Charters method, is for intermediate dexterity. So if you had like wrist surgery or anything like that, it's going to be a little bit easier to learn. And that's where you place the bristles on the occlusal as well as on the facial surfaces, and you just brush side to side around it. That's going to be very, very easy to learn as well. And this is very useful around like fixed retainers, orthodontia, anything like that, as well as dentures. It does have good interproximal cleaning because you can also do it, flip the brush side to side in between the teeth. You won't get in between the teeth as much as flossing will. Then we have the horizontal, where it is just placed horizontally onto the tooth and it's back and forth. That's no dexterity needed because you just use your whole entire arm. So that's for kids and like older people that don't have that much of dexterity. Second is flossing. Flossing is so important so periodontal disease does not happen. Periodontal disease is where the bone loss in this tooth right here, you can see, this is where the gums are supposed to be, and that's where the gums are. This is all exposed bone. So when you have periodontal disease, you have bone loss and your teeth will just fall out. It's very, very bad, and I see it all the time working at the dental office. I did talk to Haley, who is a hygienist that I work with, and she says that she sees so many mistakes when flossing. Everybody who flosses, do you just go in between the teeth, or do you push it up into the gums and go in a moon shape? Any feedback? Moon shape? Or just straight in between teeth? Yeah, it's best to go into the gums as a moon shape instead of just going straight into the teeth. So if this person flossed, they would go into the gums right here instead of just in between the teeth. And this picture is good as well. if they had a contact right here, it would just go in between the teeth. And Haley said that bleeding and decay can occur if you don't go up into the gums and remove that plaque in that area. And then the negative effects if you don't floss or brush your teeth positively and properly, you can have your teeth will fracture. This is also due to piercings. You can have a tobacco lesion if you smoke a lot or you chew tobacco. This right here, it's kind of hard to see on there, but it's a lesion caused by tobacco. And then this right here is abrasion and attrition, wearing away of the tooth, abnormally or normally. And this right here is from bulimia, so wearing away of the tooth abnormally from acid. This can also happen by pop. So if you don't brush your teeth, floss your teeth, clean your teeth, use fluoride every day or after you drink acids or sugars, this stuff can happen over time. So I hope that I did, make sure that you guys are now well informed on how to brush your teeth. So this stuff right here does not happen, and I hopefully won't see you guys in my hygiene room doing a scaling to get all of this tartar off. Because it's not very fun, and you will lose your teeth, and nobody wants to have dentures. Okay?